All right, so we're looking at some x-rays here. And we're looking at, first off, what I do is I look at the curve system. Okay, so she's actually got a really good lumbar curve here. The mid-back can use a little bit of work. All right, we actually look at the disc spaces are starting to crowd in on the front. Neck looks actually pretty good as well. All right, so the main thing is mid-back. We actually adjusted sacrum last time. We're going to follow up on how that went, where we see some pelvic tilting. So that's why we adjusted the sacrum. We actually did a BP last time. As we come up here, there's a tilt, so the low side of the hip is going to have the lumbar spine tilt to the low side typically, and then her neck tapers off to the left a little bit, so it's probably a misalignment or subluxation here, the lower thoracic, so T12. I'm going to keep an eye on, and that's actually what she has written down here. Her listing is PLI-T. All right, so I'm looking at the needle here, and so that reading up top, so the C1, C2 area. So I'm using the instrumentation looking for inflammation, nerve irritation. That's one of our criteria. We talked about that lower T-spine, so I'm gonna look and see if I have a reading here. A little bit of chatter there, a little bit of a reading. So we cleared most of it out last time. So we're gonna motion it and check it again. So let me have you bend forward. Good, back up. Great. Another thing too, we want to look at T12 is just a little bit of a skin lesion here, so it's typical with inflammation. So I'm visualizing that. You can actually see her spine tapers off to the left. All right, so that's at this, what we call a deflection point. So I can have you bend to the left, right there. See how everything stacks up, bend to the right. And you can see just a better arc here, okay, back to the middle. Moving here, we're gonna palpate the neck. Okay, so I'm gonna use my fingers here. We're palpating both sides of C1. All right, a little bit of C2 here. Okay, a little tight there. All right, I'm gonna rotate to the left, looking at right atlas. I'm gonna come around here. Good, pretty good motion. So since we adjusted this pretty deep last time, I'm not gonna adjust it as deep. So I'm gonna really control my thrust. Okay, that's all we needed, great. 12. All right, 5, 4, 3, 2, 1, 12. Okay, so we just want to count twice. But my thrust is going to be on that left side. Good. Good. A little more. Good. I noticed that she does have a little bit more of a lumbar curve, so we had to go a lot of I to S on that.